If you need surgery to fix an injury in sports and exercise, can you keep playing and do it at the end of the year? Or do you need to stop and have surgery right now? I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, and I provide education, information, commentary on sports and exercise injuries and injury treatments and injury prevention for athletes and active people so that you can stay healthy and perform your best. You know, I think it's never a good thing to need surgery for an injury if you're an athlete or if you're just an active person that likes to exercise. But the question is, do you need to have that surgery now? Meaning you have to drop everything and have it, you know, so that you don't do any further damage to yourself, or can you put it off until it's a better time, you know, maybe at the end of the season, or maybe it's related to work and you want to do it when you have a break at work, or maybe after a vacation or some personal thing you have going on. So in today's Ask Dr. Geyer video, I want to discuss that very question related to a common injury in throwing athletes, and that's basically the Tommy John injury. Okay, Scott asks, I'm a 22-year-old student who throws javelin competitively in college, and I also high jump. 2 months ago, I completely tore my UCL and was told I need surgery. I was wondering if holding off on the surgery through my senior year would be a bad idea. I don't want to miss my final year, but I also want to do what's in my best interest. There's currently no pain. Any advice would be extremely helpful. Thank you, and I appreciate what you do for others. Well, thank you so much, Scott. I hope all of this by video or articles that I write, my podcast, I really do hope that it helps people dealing with sports and exercise injuries. So it's interesting, we think of Tommy John injuries, UCL injuries, or the ulnar collateral ligament of the elbow. We think of that in baseball pitchers. Far and away, that's the most common athletes that we see Tommy John injuries, but you see them in other sports. And actually, the first description of ulnar collateral ligament injuries came way back in the 1920s. It was in a competitive javelin thrower, so it does happen. Now, the question with the ulnar collateral ligament, and the reason so many baseball pitchers undergo surgery is that they can't pitch effectively without that ligament. You know, the pitchers lose velocity. They lose the ability to locate their pitches the way they want. Not just even the pain. They can't do what they want to do as well as they want to do it. Now, we've talked about in other Ask Dr. Geyer videos, we've talked about how if you're not a throwing athlete and you suffer an ulnar collateral ligament injury, you very likely won't need surgery. We've seen professional athletes in the NBA and the NFL avoid having surgery for theirs, and they got back to play just fine. But in an overhead athlete like baseball pitchers, it might be a little harder. Javelin may be the same way, slightly different forces, and you're not worried as much about locating the javelin as you are about distance. But at the end of the day, the question to ask is, can I do what I want to do as well as I want to do it? And if so try it out. He could try this out, go out for a week, 2 weeks, and see how it goes. Throw the javelin, see if it hurts your performance not having that ligament intact. Maybe you try a little bit of physical therapy first and see how it goes. And if you can do it, terrific. Then basically throw through your senior year and then decide, do I need surgery at all? Because if I'm not going to be doing those type of movements, maybe I don't need the surgery. Or if I am, then maybe you have it at that point when you have time to recover. Because surgery is usually about a year-long recovery process. It's an outpatient surgery, but there's a lot of work getting the elbow motion back, getting the strength back. It's a long process, and it would definitely knock him out for that last year of sports. And that's really the thinking with any injury, and do I need to do it now? The ulnar collateral ligament, there's not as much of a risk of doing more harm to other parts of your elbow like there may be with an ACL. We've talked about this before in another Ask Dr. Geyer video. Somebody asked if you need to have surgery, or can you play through an ACL injury? That's a little different because the knee is potentially unstable and you may do other damage. You may hurt the meniscus, you may hurt the articular cartilage. So those, it's really hard to try to play through. This one, if you can do it, I think it's fine. But you ask yourself, can you do what you want to do effectively without having surgery? And then am I doing more harm to myself if I don't have the surgery and if I wait? Or if I not just have it now, but if I wait a few months, am I doing more harm to myself? Okay, is this a scenario you found yourself in? Have you suffered an injury and wondered, should I do surgery now or can I wait a few months? I would love to hear your experience, your thoughts. So below this video, Tell me about it. Leave your experience. I'd love to read it. I know viewers all across the world would be interested because they're going through the same thing and are trying to make a decision about what's best for their body. So, leave your comments. Again, I think it would be really helpful, and read the comments of others. And if you know somebody with this same dilemma, maybe they're trying to decide if one of their kids needs surgery, or maybe their husband or wife, or maybe it's them. Regardless of the injury or the surgery, please share this video because I really do think it would help. Now, if you like videos like this and you want, let's say more information on sports and exercise injuries and injury treatments and injury prevention, subscribe to my video channel. I record a couple of these videos every single week, and I would love to deliver those directly to you. And finally, there's so many resources on ways to stay healthy, prevent injury, perform your best in all sorts of sports and exercise that I only share with people for free, mind you, but I only share them by email. So go to my website, drdavidgeyer.com. Enter your name and your email, and I'll deliver those directly to you several times a week. Thank you so much for watching. Again, if you're trying to decide if you should have surgery now or later, leave your experience. I'd love to read it. I'd love to hear what you're going through, and I look forward to connecting with you in our next Ask Dr. Geyer video. Thank you so much.